in general, I think it's very important for the listeners to understand that even the field or the discipline of medicine itself is very much based on a system that was racist, a system that exploited enslaved Black people. So some people may have heard of, J. Marion Sims, the father of modern gynecology. He was the first president of the American Medical Association, which is the oldest and largest organization of physicians. But he made these really very important discoveries. So I'm sure maybe half the listeners, or more than half, when you go to get your OBGYN exam, there's a tool that's used called a vaginal speculum. So created that, but also created some surgical fixes, solutions to something that happens actually during childbirth, during traumatic childbirth, a type of fistula. And so, but he made these discoveries on enslaved Black women who could not give consent, right? They could not give permission. These were very painful surgeries. And even once local anesthetic had been described and was used by other surgeons and physicians, did not use it on those women. And those women really remained invisible for a very, very long time. And his statue was actually in front of the New York Academy of Medicine up until the late 2000 teens, right, before it was taken down. But that's just one story. Like, that's just one. So these discoveries that are deeply rooted in these myths that there's something very different about Black people and our bodies. And I think people like your listeners, our readers of our books, need to understand the history, because when you understand the history, you also can understand why in 2025 we may still see, why we see racial health inequities.